Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today's topic in Neighborhood Health Watch, menopause treatment options for women who are going through it and the men who love them. Now, menopause is a natural biological process which ends a woman's ability to have children, but it doesn't mean you can't be healthy, vital, and sexual. Menopause occurs 12 months after your last menstrual period. The average age is 51, but it can happen earlier in your 40s. Hot flashes is the most common symptom. Dr. James Jones with Henrico Doctors Hospital is here to talk more about effective treatment options. Now, I mentioned to start off one of the symptoms, hot flashes, but there are others.
There are others, yes. Vaginal dryness occurs later on in the menopause. There are mental issues and mood changes that happen with the menopause. There are a lot of psychological and physical changes that happen during the menopause. Usually these occur later on in the course of the postmenopausal state. Hot flashes being the seminal event of the hot flash.
Now, some of the treatment options, there are a number of treatment options. How does a woman decide which is right for her?
Well, that's a very good question. The woman should decide based on her own wishes and what she is trying to treat. If she's trying to get relief from hot flashes, then the best form of therapy, of course, is estrogen therapy. There are other therapies that are available for women who've had cancers and things like that. Some of the SSRIs and things like that, but mainly estrogen is the best form of therapy.
And we talked a little before the segment about alternative medicines.
Right.
Talk about those. I mean, I have girlfriends who use some of the alternative medicines, and I wonder if they work.
Most of those alternative medicines, like evening primrose or black cohosh or St. John's worts, they work initially because of what we call the placebo effect. Okay, if you give somebody a medicine and says it's going to work, then they feel that it's going to work, and it does work for a while. But after that, then you get back to reality, and, and then you realize that this stuff is really not working. Most of the alternative therapies are not very well as far as stopping hot flashes or any of the other symptoms of menopause.
All right, it has been so informative. Thank you, Dr. Jones, for joining us. We appreciate it.
Thank you.
Heather?
Accurate, reliable, breaking weather special.